Chapter 9 continues our coverage of insurance, a thrilling topic to be sure, but a necessary one. Without it, an accident or illness could cause financial disaster. So Chapter 9, we move to health and disability insurance. Our first three learning objectives. As mentioned, a major health issue can drive medical expenses to the point of forcing people into bankruptcy. There are a variety of health care options and breadth of coverage that you need to understand and explore before settling on a plan for you and your family. Once you find plans that fit your needs, compare them based on which features are most important to you, which are worth the cost. Our learning objectives continued. Evaluate the differences between private health insurance plans such as Blue Cross Blue Shield versus government programs, Medicare, Medicaid, and plans offered through the Affordable Care Act. Many young people fail to recognize the importance of carrying disability insurance. Quote, "It'll never happen to me." Finally, we look at what has been driving the continuing increases in healthcare costs. If anything has happened over the last decade and the advent of the Affordable Care Act, it has brought home to all of us the importance of health insurance. Healthcare costs have risen so much that even a relatively minor illness or injury can run up very high expenses. Health insurance and disability insurance is meant to ease that burden, shifting the risk from you to the insurer. On a year-to-year basis, health insurance covers annual doctor visits as well as standard wellness tests aimed at keeping you healthy. In the event of a major health issue or injury, health insurance really takes on added importance, as can disability insurance, which will pay you replacement income while you're off work. Group plans. Most employed people are insured under group plans. Employers typically sponsor these plans and absorb some or most of the cost. This is by far the least costly health care. The Affordable Care Act of 2010, ACA, requires large employers to provide health insurance coverage for all employees, and we'll cover this more later in the chapter. HIPAA, the Health Insurance Portability and Accountability Act of 1996, established federal portability standards so that if you change jobs, you need not lose your health insurance. You can buy an individual health care policy from a variety of companies, like Blue Cross Blue Shield. This can be very costly, as you are not getting the pooling benefit of participating in a group plan of some sort. One of the latest ideas to lower health insurance expenses for those not covered by an employer-sponsored plan is to allow some type of group insurance coverage to take advantage of the lower cost of pooled plans. COBRA was passed in 1986. COBRA stands for Consolidated Omnibus Budget Reconciliation Act of 1986. It requires employers who meet certain criteria to offer employees and their dependents the option to continue group coverage for a certain period after a layoff or if you quit. COBRA coverage is very expensive, as you are bearing the full cost of the policy without any employer subsidy. However, this can be a bridge option as you leave one job and move to another. As the slide states, you have 60 days from the date your coverage ends to elect COBRA coverage. Our second learning objective relates to understanding insurance coverage so we can make informed decisions about what type of coverage is appropriate for each of us. Basic health insurance coverage is outlined on the slide. Hospital room and board and charges. This usually involves a deductible, which you pay up front, after which your insurance kicks in and typically pays 80% or more. Surgeon's fees, physical care, and tests. This is considered bare bones coverage. Major medical is designed to cover serious injury or long-term illness. It may and will probably include a deductible. If a policy specifies hospital indemnity, it means the insurance pays you a fixed amount for each day you're hospitalized. It does not cover expenses. It may be used as a supplement to other plans. Many group plans also offer dental coverage as an option. They may offer vision coverage as well. So-called dread disease policies pay on very specific conditions. They're illegal in some states. Aflac cancer coverage is a major player in this area. Long-term care insurance is a relatively recent addition to the insurance landscape. Long-term care has grown in popularity as baby boomers age and life expectancy has increased. We're living longer. We'll need care. Long-term care pays for either in-home or nursing home care. Be aware, a nursing home or assisted living facility can run well over $6,000 a month. General wisdom is that long-term care makes sense for those with a net worth between $100,000 and $2 million. Below $100,000, you'll be eligible for government care. Above $2 million, you can afford your own care. Eligibility for insurance and the premium you'll pay varies by age, marital status, and number of dependents. The age part is eliminated with an employer group policy. Insurance typically pays assigned benefits, meaning they pay the doctor or hospital and provide you a recap. Coverage frequently has a daily limit that it will pay for a hospital room. Co-pays for office visits are quite common, usually $20 to $40. When reviewing a policy, take a careful look at the service benefits, exactly what is, and more importantly, what is not covered, and what is available as an added fee option. Typically, the larger the group, the broader the coverage, the wider the variety of services provided by the policy. All these factors need to be considered when choosing a policy. Benefits may have limits on hospital days or a maximum dollar limit per person. Cosmetic surgery is typically not covered, nor are pre-existing conditions, though this has changed with the passage of the ACA. Is renewal of the policy guaranteed? Under what conditions can the insurer cancel your policy? Be sure you fully understand all these provisions. If you're choosing among several policy options, here are the trade-offs you need to consider. Actual cost, reimbursement, versus specified amounts, indemnity. The slide offers an example. Katie and Seth were both charged $200 for an office visit to a specialist. Katie's plan has a $300 deductible, so she's responsible for the full amount unless she's met her deductible, and then her policy will pay 100%. Seth's indemnity policy will pay $125 for a visit to a specialist. Internal versus aggregate limits. Deductibles. How high are they? This has gotten a lot of coverage relative to the plans available under the ACA exchanges. Is there an out-of-pocket limit that restricts how much you would pay? Are the allowable charges reasonable relative to actual cost in your area? If they're too low, you're going to be responsible for the difference. If you have options as to your health insurance, how do you decide? Key points are, of course, how much can you afford to pay? What level of coverage do you need? What coverage does your employer offer? You can choose basic, major medical, or both. This list from the text includes what the authors consider healthcare must-haves. Basic coverage for doctor and hospital bills. Minimum 120 days hospital room and board. Pays at least 80% of out-of-pocket cost after deductible. No unreasonable exclusions. Out-of-pocket expenses per year limited, excluding vision, dental, and prescriptions. This is a useful list to check off against any plan you're considering. We need to look at and compare private health care options versus those offered by the government. Private insurers offer both individual policies and group policies through an employer. One of the largest in the U.S. is Blue Cross Blue Shield. Blue Cross is hospital care. Blue Shield is surgical and medical. As an example, you can buy an individual policy from Blue Cross Blue Shield, but they also run the program offered to state of Mississippi employees. Note that insurance is state regulated. Blue Cross and Blue Shield of Mississippi is coordinated with, but not the same as Blue Cross Blue Shield of Tennessee. I am personally covered through Ole Miss by Blue Cross Blue Shield of Mississippi, but I live in Tennessee, so any claims for me are filed with Blue Cross Blue Shield Tennessee and coordinated with Mississippi. This has not been an issue. HMOs, or health maintenance organizations. Managed care is designed to control the cost of health care. It's prepaid health care. You have a primary care physician you select from a group of providers, and you need a referral to visit a specialist. The focus is on prevention and wellness. It offers basic and some supplemental services. With exclusive provider plans, or EPOs, like HMOs, you're required to use providers in the plan, else you bear the full cost. But there's no primary physician designation required and no referrals needed for a specialist. A preferred provider organization, PPO, more costly than an HMO, but you have more providers to choose from, more choices, less restrictions. Point of service plans, or POS, combines HMO and PPO plans. Like an HMO, you have a primary care provider who oversees your care, including access to specialists. But if you seek care outside of the HMO approved list, you'll pay a higher charge. Home health care agencies have grown in both availability and popularity. Medical care provided in your home. It's less costly than hospital care. There's also employer self-funded plans. A large employer or group of employers may form their own group. Each employer group member collects premiums. Medical expenses are paid from the group's funds. There's one of these in Tennessee, TICUA, Tennessee Independent Colleges and University Association. They have about 35 members. It includes Christian Brothers University, Rhodes College, Vanderbilt, LeMoyne-Owen, Belmont, University of the South, Sewanee. Healthcare accounts work in various ways to help users save money on their medical expenses. HSA, health spending accounts, are money contributed to a tax-free account. HRA, health reimbursement accounts, are funded solely by the employer. Unused funds are carried over year to year, but they're usually tied to a high deductible policy. Flexible spending accounts, or FSAs, are pre-tax dollars contributed by employees. The funds are managed by employers, and the unused funds do not roll over. This exhibit, also in your text, compares HMOs, EPOs, PPOs, and POS plans in terms of cost, restrictions on providers, and access to specialists. And this exhibit summarizes the important features of HSAs, FSAs, and HRAs. Medicare, federally funded health care for those 65 and over or disabled. At age 65, you must sign up for Medicare Part A, even if you're still covered under an approved employer-provided plan. There's no charge at that point. As you've seen in a million TV ads, Medicare does not cover everything, making the patient liable for the difference. This gap can be a huge issue for senior citizens on fixed incomes. There are 4 parts to Medicare. Part A is hospital insurance, required at age 65. Part B is medical insurance, outpatient services. Part C, a Medicare Advantage plan, and Part D are prescription drug coverage. The Balanced Budget Act of 1997 created the Medicare Choice Program, which allows a managed care option. Looking at each part of Medicare in a bit more depth. Part A. This is the hospital portion of Medicare. This is the part that is required at age 65, whether you're retired or not. If you do not sign up within a certain number of months around your 65th birthday, you may pay a penalty forever. Pays for inpatient care in a hospital or a skilled nursing facility, and it covers some home health care and hospice. Part B covers doctor services. The deductible for 2021 was $203, and Part B pays 80% after the deductible is met. Part C, Medicare Advantage plans are available in many areas. They combine A and B into one plan. Part D is prescription drug coverage, and this can be a huge expense for seniors on Medicare. This chart in your text recaps the 4 parts of Medicare A, B, C, and D. The plans you see touted on TV are generally Medigap plans. They close the gap in coverage in Parts A and B, covering those charges not covered by Medicare. Medicare offers a publication to help those considering a Medigap plan, and you can see the link on the slide. This chart, also in your text, offers a comparison of various Medicare plans with a brief description of each. While the time to sign up for Medicare may be way in the future for many of you, this could be a help to your parents or grandparents as they have to make choices. Medicare does not cover everything. See the partial list on the slide. It does not cover deductibles and copays, some skilled and long-term care, out-of-hospital prescription drugs, routine checkups, dental care, immunization. In addition, the amount paid may be limited. The plans you see on TV are generally Medigap plans, as mentioned. They close the gap, covering those charges not covered by Medicare. AARP is one of the big groups offering Medigap plans. Medicaid sometimes gets confused with Medicare since both are government programs. Medicaid is state-run and intended for low-income persons. It covers basic physician and hospital services, as well as skilled nursing and home care, prescription drugs, glasses, and preventative care for those under 21. The Affordable Care Act greatly expanded the Medicaid rolls in many states. There are other sources to help with health care costs. Some states will help with Medicare premiums. There are Medicare savings programs to help offset cost, and PACE, programs of all-inclusive care for the elderly, provide in-home services. The Affordable Care Act of 2010, or Obamacare, is one of the most sweeping changes in health coverage in recent times. The Patient Protection and Affordable Care Act of 2010, the ACA, set aside $635 billion over the next 10 years to help finance health care reform. The law is expansive and implemented over several years, but all major provisions took effect in January 2014. On June 28, 2012, the Supreme Court, in a 5-4 vote, upheld the majority of the landmark Affordable Care Act. The slide lists some of the key provisions. Tax credits to small businesses to offer coverage. It prohibits denying coverage to children with pre-existing conditions. Temporary high-risk pool for the uninsurable. It eliminates copays for preventative care. It allows young people to remain on their parents' coverage to their 26th birthday, and it prohibits lifetime caps on coverage. Continuing some of the list of provisions, the ACA created the state-based insurance exchanges for individuals to purchase coverage. Medicaid was expanded significantly under the ACA. It requires most to purchase insurance. The intent of the Affordable Care Act was to increase the number of people covered by insurance, drive down the rapidly increasing cost of health care, and improve access to health care in the U.S. The ACA provides subsidies through cost savings and tax credits to reduce the cost of insurance. The insurance marketplace, the exchanges, allows consumers to compare various plans and choose the best one for their situation. A close relative of health insurance is disability insurance, frequently called disability income insurance because that's what it provides, income when you cannot work due to illness or accident. Younger people tend to not consider the importance of this coverage, but an accident or serious illness can happen at any age. Disability insurance is not extremely costly and is frequently offered as part of an employer-provided insurance program. Short-term disability insurance usually provides benefits within a short period of filing, which can continue for up to a year. Long-term disability is meant to provide income for someone who is not expected to be able to work for a lengthy period, over a year. There are several sources for disability income. Workman's compensation pays if your injury or illness comes from your job. Most employer insurance programs offer short-term and long-term disability insurance at low rates. For a disability expected to last over a year, you may be eligible for Social Security benefits. Private disability insurance is also available to supplement other sources. These usually pay 40 to 60% of your pre-disability income. What you need to look for in a disability insurance policy. Exactly how does the policy define disability? What's the waiting or elimination period? Benefits do not start immediately, usually 1 to 6 months. The shorter the waiting period, the more costly the policy. How long will the policy pay benefits? A specified number of years, until you reach age 65, for life? What percentage of your income will it replace? Greater payout, greater cost. Does the policy pay only for accidents or accidents and illness? Is the policy automatically renewable? Exhibit 9.5 in your text gives you a table to figure out how much income you could receive from all sources should you become disabled and unable to work. If something does happen, will you have enough income? Our final topic looks at the rising costs of health care. The U.S. has the highest per capita health care cost in the world, but we also enjoy excellent health care. By 2025, government spending on health care is expected to reach 47% of national health care costs. One contributing factor to these costs are the high administrative costs involved in health care, estimated at 26% of the total cost. This is Exhibit 9.6 in your text. It's obvious that health care expenditures in the U.S. have been rising and are expected to continue through 2027. Since this text was written before the COVID pandemic, it'll be interesting to see what this chart looks like when it's updated. Besides administrative costs, what's driving these increases? Technology. It's become very sophisticated and expensive. The elderly are living longer and requiring more health care for longer periods. Regulations, lots of them, have certainly contributed to the rising cost and the high administrative expenses. You can see the list, and it's continued on the next slide. The average earnings of healthcare professionals has risen rapidly. There's a tendency to use more expensive medical care than is actually needed. Inflation. And then there's always fraud, waste, and abuse. So what's being done about it? There has been a rise in community health care programs aimed at encouraging preventive care and general health education. Paying cash. Not something we see a lot of anymore, but if your doctor doesn't have to deal with an insurance company filing, you might just get a discount. What can you do to reduce your health care costs? Consider a flexible spending account if it's offered. Consider a higher deductible plan. Ask your physician about generic drug options. Use an online pharmacy for those permanently on a drug regimen. Ask if follow-up visits are really needed. Definitely review statements from your doctor and insurance. Take care of yourself. Eat a balanced diet. Keep your weight under control. I'm sorry to say that Mississippi is one of, if not the most obese state in the United States. Not an honor we want. Unfortunately, being overweight can drive or aggravate other medical problems: heart disease, diabetes, high blood pressure. Avoid smoking. If you smoke, stop. Many insurance programs cover smoking cessation programs. Don't drink excessively. Everything in moderation. Get sufficient rest, relaxation, and exercise. A serious exercise program is great, but just walking more would help. Park farther away from the store and walk. You won't freeze, you won't melt. Get some type of device and track your steps to motivate you. Drive carefully. Protect yourself from medical ID theft. This is just another form of identity theft that targets your medical records as a source of ID data. And we're to the summary. I'll scroll through the slides. Recognize the importance of health insurance, types of health insurance, major provisions of health insurance, trade-offs, private health care plans, health care accounts and government programs, disability insurance, drivers of high health care costs, and the continuation on high costs of health care. And this ends Chapter 9.